Assalamu alaikum, it's here Dr. Fatma. Today we are going to study anemia due to lead poisoning. Without further ado, let's get started. In the start of the lecture, we will see some distinctive features of anemia due to lead poisoning. That is, it is microcytic anemia. MCV will be less than 80 femtoliter with basophilic stippling on peripheral blood smear. Basophilic stippling, that is, there will be aggregation of residual ribosomes, hemolysis, destruction or lysis of the RBC, and siderobladtic anemia-like feature. The people who are affected with the lead poisoning are adults who work in the battery factories or who have exposure to the lead, and the children who use lead pens for their drawings. Okay, now we will see the mechanism. As in the previous lectures, we have seen that the heme synthesis, the RBC erythrocyte synthesis occur in the bone marrow, and different enzymes are involved in the synthesis. So what the lead do, that it inhibits some of them like furosylatase and the gamma-aminolevulinic acid dehydratase. So lead will inhibit this enzyme. When the lead will inhibit this enzyme, the heme synthesis will be inhibited and there will be increased free erythrocyte porphyrin buildup. Okay, as erythrocyte is formed from the heme and the globin, heme from the iron and the protoporphyrin ring. So the free protoporphyrin will be increased, and it also inhibits the ribosomal RNA degradation. Now we will see the pathophysiology. Heme synthesis is disrupted. The lead acts on the body, the lead acts on the different receptors, on the different systems and affect them in a different way. Like it will inhibit the heme synthesis, oxidative damage to the several organ system, demyelination and axonal degeneration in the nervous system, increased hemolysis, increased lysis of RBC, erythrocyte survival, that is the normal lifespan 120 days, that will be decreased, and renal toxicity and the hypertension. Clinical manifestation. To memorize the clinical picture of the anemia due to lead poisoning, I made a mnemonic for you people, ALEEM CAP. ALEEM, A for abdominal pain, L for lead line, Burton's line, lead line on the gingiva. Okay, irritability, the person will irritate, myalgia, muscle pain, constipation, arthralgia, joint pain, and peripheral neuropathy, numbness of the limbs. And to memorize the features specifically, the mnemonic is lead. As you can see, lead, L for lead lines on the gingiva and the long bone epiphysis. Here you can see this different color shows the lead line on the gingiva and the epiphysis of the long bones. Encephalopathy and erythrocyte basophilic stippling. Erythrocyte basophilic stippling, aggregation of the residual ribosome is known as basophilic stippling. Abdominal colic pain and anemia. Anemia, which type of anemia? Microcytic anemia, and the waist and the foot drops. Okay, let's see what we will find in the lab findings. In the lab findings, you will see that the lead level is increased, basophilic stippling, residual ribosome aggregation, FEP level is increased, free erythrocyte porphyrin level is increased, microcytic hypochromic anemia. Microcytic MCV less than 80 femtoliter, hypochromic, that is HB level will be decreased, anemia, decreased RBC and decreased oxygen carrying capacity of the blood. Lead lines on the X-ray film of the long bone epiphysis, as you have seen in the diagram, decreased hemoglobin, decreased hematocrit, decreased MCH, mean corpuscular hemoglobin, that is the mean size of the hemoglobin in RBC, and the MCHC, mean corpuscular hemoglobin concentration, is also decreased. What is basophilic stippling? Seen mainly in the peripheral smear, aggregation of the residual ribosomes, and associated with the siderobladtic anemia, lead poisoning and the thalassemia. Treatment of the anemia due to lead poisoning. Reduction of lead exposure. Adults, they should change their job or do another job. In the children, they should avoid using lead pens for their drawings. And chelation with the succimer if the blood level is less than 80 microgram per deciliter. And the succimer is the first line drug in the kids and is less toxic. And succimer, how you can memorize it? It suck in lead out. So succimer for the lead poisoning. And the dimercaprol is the first line drug in the adults. And vitamin C, you can give vitamin C, dimercaprol, first line treatment in adults, penicillamine and the calciumedic acid. Okay guys, what we study in today's lecture, we see the anemia due to lead poisoning. It is microcytic MCV less than 80 femtoliter with the basophilic stippling aggregation of the RBC. On the peripheral blood smear, hemolysis and siderobladtic anemia. The affected people are adults and the children, those work in the battery factories and who use lead pens for drawings. Absorbed via the lung and GI tract. Mechanism is it inhibits the ferrochelatase and gamma aminolevulinic acid dehydratase. So inhibit the heme synthesis and the free erythrocyte porphyrin FEP will be increased. Pathophysiology is it affects heme synthesis, oxidative damage to the several organ system, demyelination, hemolysis, erythrocyte survival is decreased and the renal toxicity and hypertension. What are the clinical manifestations? Memorize them with the Alim cap, abdominal pain, lead line, irritability, myalgia, constipation, arthralgia and peripheral neuropathy. Specific features for them: lead lines on the gingiva called the Botton's line and the long bone epiphysis, encephalopathy and erythrocyte basophilic stippling, abdominal pain and the anemia, waist and the foot drop. In the lab findings, you will see that the lead level will be increased, basophilic stippling, free erythrocyte porphyrin level is increased, microcytic, decreased MCV less than 80 femtoliter, hypochromic anemia, lead lines on the X-ray film or the long bone epiphysis, hemoglobin concentration decrease, hematocrit decrease, mean corpuscular hemoglobin decrease and mean corpuscular hemoglobin concentration is decreased. Basophilic stippling and how you will treat that. First line of drug is dimercaprol and in the children first line is succimer which is less toxic. Also you can give vitamin C, penicillamine and the calciumedic acid and reduce the exposure to the lead. Thank you so much for watching the video. Don't forget to subscribe the channel.